What's up, you guys? It's your boy Miguel giving your daily dose of radiation in today's video. How often do you have to override machines to be able to shoot your exams? So, to give you context, I work night shift at the hospital, do a lot of overtime, so I do work in day shift too. So, I would say the time you would have to override your machine is for a few times, okay? So if you're doing an exam on your portable machine, the only time you would kind of override would be if there's a trauma and you kind of what we call quick start, and you would override having to need to pull the information from the patient and later on link it on. Occasionally, if you overheat your machine, there's like ways to kind of trick it from thinking it's not overheated. But like you'll have to rotor it a certain way, or you have to shoot it under a certain exam to kind of trick it to get it to shoot. But usually then you can maybe get a few shots in before it kind of picks it up to knows that you're doing that. You have to completely reboot it. As far as like the big main X-ray with the whole table and everything when you bring them back, some machines, if you angle the tube, you'll have to flip the switch. That will happen. Usually that's like the big reason why you would have to overdo it, like flip the key. And occasionally if your SID's off to get like more SID than the standard amount, then you'll have to flip the key to get that amount. Sometimes when you're shooting and you have to do where you set a technique, occasionally you may have to bypass certain things to be able to get that most optimal exposure and go above the recommended things, because over time systems and equipment gets worn down and they don't shoot as properly. Like we have two rooms that are completely the same. One room slightly gets used more than the other because of the capabilities, the usefulness and more easier. So one room you'll have to shoot it hotter than the other room, and the other room like the picture will come out more burnt compared to the other room. So it's kind of like a mix of both worlds. So hopefully this gives you insight of what to expect. And yes, been your boy Miguel. See you on the next one.